Thank you, Madam Speaker. 2020 has proven to be one of the worst, most difficult years that most of us have had to endure, and it just got worse this winter. 2018, I had to deal with a traffic safety issue when a child was killed while crossing the street on Elizabeth and Alexander. Last year, we had to deal with police officers shooting teenagers, an intense meth and opioid crisis, random acts of violence against our grandmothers, and a father murdering his own 2-year-old son. This year, the less fortunate living in my ward are affected with and are dying from COVID virus, and now catching trench fever, a preventable disease we haven't seen since the dire conditions of World War I. Most of these could have been preventable and even avoidable. All three levels of government have three basic functions: public health, public safety, and public education. As a government, we are also accountable to deliver the human basic rights to our citizens: shelter, clothing, public washrooms, food, and access to clean water. And we all know we are failing at these expectations. One just needs to look outside our window right here at City Hall to see the effects of government neglect. Residents' mental health is deteriorating and people are dying. All of this exacerbated with the disproportionate systems our government has created during this pandemic and for the generations before us. As leaders, how many more illnesses and deaths do we need to see before we wake up and get to work to make the needed systemic changes? Our city remains sick. The data clearly indicates that people who live in poverty are disproportionately susceptible to catching an infection, whether that's COVID, pneumonia, tuberculosis, hepatitis, trench, who knows what else. The most impoverished people in Winnipeg live in downtown and in Point Douglas, where basic needs have long not been met. Food deserts, the lack of public washrooms and showers, mental health supports, and housing insecurities have been magnified for all to see during the pandemic. Many of my residences are essential and frontline workers who work with the public and do not have the privilege of choice to work from home. With the end of many financial supports, families have no choice but to continue to work in public spaces regardless of personal or family health issues. Many of my residences live in multifamily buildings and in multi-generational homes, which makes space limited and physical distancing within the home nearly impossible. The most aggravating and frustrating part of my role is that municipal government is not mandated to make decisions for most of these critical issues that occur in the Point Douglas ward. I literally have no jurisdiction over the provincial or federal government's budget or mandate. The only influence I have is this operating and capital budget in front of us today. Police, fire, transit, community services, public works, property planning, water and waste, just to name a few core city services. Even my influence translates to only 1 vote out of 16. Even within our own city services, we still are dependent on provincial and federal funding. One just has to look at the finer details to see that we are currently backfilling this year's budget from the annual provincial capital grant of $75 million and the $42.2 million of the the federal Safe Restart funding. I've got to be honest with you, this budget is okay. Keeps the light on. It's a status quo budget. And it's been like that ever since I was first elected. Why? Because as a city, We need to make sure it remains balanced. That itself is very important to Winnipeggers, that our budget is balanced. I know it was not easy for the Mayor or the Chair of Finance to do the heavy lifting during this yearly update, especially with a pandemic upon us. However, if we listen to our community during this and last year's budget process, we would have heard loud and clear from hundreds of our community members that they want to see investments in community services, in the environment and in the arts. They want to see recreation and transit and libraries. They also want what we want, a balanced budget. But citizens are asking for more than a fiscally balanced budget. They are also asking for a socially balanced budget. Sure, we have some funding in place for 24 safe space, mental health supports for frontline workers and ambulances and fire emergency services, waiver of library fines, $50 million provincial grant for capital investment in recreational infrastructure and libraries, a $2 million federal Safe Restart money to provide grants for affordable housing. But that is just a drop in the bucket. Since I've been a councillor, the police operating budget continues to be approximately 31% of our annual household tax bill, while the Community Services, Recreation, Parks receives 19%. I understand people want and need security. Most Winnipeggers prioritize safety in their communities. But they know just as well as we do that the police are not the only answer to mental health crisis issues or domestic violence. And yet, year after year, the Winnipeg Police receive the biggest piece of our budget, while all other mechanisms that attempt to reduce crime are barely staying afloat. We do need police. I'm not trying to say we don't. There is crime in our communities, and we need the effective response of the police. I'm going to probably ask for maybe a 5-minute, 2 minutes. Did you know that the tax-supported operational budget for the Winnipeg Police Service has increased by 114% since 2004?
Councillor Rollins moves extension. All in favour? Contrary?
With the per capita increase of $110. Within that same time frame, our community services budget has decreased by $19 per capita. We have been constantly underfunding our community services recreational parks department in favor of the police budget. These are systemic, long-term institutional issues that we must take the first steps into beginning to fixing them. And for these reasons I just stated is why I continue to not support the police operating budget again this year. Michael Champagne asked us, are we strengthening families with this budget? I personally and wholeheartedly know that we are not investing enough into our people or into the community. Every single councillor has heard that the reduction in library, recreation, and transit services have a substantial negative effect on Winnipeggers. This pandemic has shown us that we can pivot on a dime and find new and better systems and priorities. Rapid innovation is possible. So why are we, as a government, hesitating to innovate and respond to the social inequalities in our city within this operational budget? There are many issues that have converged in Point Douglas and in the downtown that need more budget support. Madam Speaker, the question I want to ask ourselves, are we going to be the community leaders who effected a positive, lasting, and much-needed change to how we as a city develop better outcomes to make our communities safer? I just need 1 more minute.
Councillor Rollins moves extension. All in favour?
Or are we going
Contrary
to be the
carried.
council that ignores the needs of our citizens, maintains the status quo, and allows another year to pass by without responding to the needs of the people who live here? Will we permit the continued reduction in community services, libraries, and transit, and ignore the calls for action to address them? I urge my fellow councillors to think about the future of this city and to create an operational budget that reflects and respects the needs of a socially balanced budget for all Winnipeggers. Thank you, Madam Speaker.